is Michelle Stoddard, who her son was actually the reason why Project Blackout started in Windham.
Oh, okay.
So her son, Cole Stoddard, passed away at the age of 5 after battling neuroblastoma. So the first game was actually in Windham, and it was really small. It was just the kids wanted to do something. She was a first grade teacher. She still is a first grade teacher in the Windham schools. And when her son was diagnosed, they were selling bracelets and just trying to make it about, showing support for her and for her son. Alvern just exploded.
Oh, wow.
I mean, the amount of community support was really great to see. And unfortunately, they also had a lot of honored families, which is always, it's a hard piece for us because we wish that there was no families in any town. But being able to bring those families in and make sure that they were at the game and that they could honor children that they've lost to cancer or celebrate those that are currently going through treatment and trying to become the next wave of survivors that we all want was really great to be able to have the whole community rally around that from the football game. We have one young woman in Windham who is an amazing advocate of early detection. Her mom had taken her in to just a normal well check when she was young, and at that time they didn't live in New Hampshire. But she was diagnosed really young, and it was treated properly, and she is a thriving, beautiful, smart, well-spoken, and just like a vision of what everyone hopes that their child can be if they do get this type of diagnosis. And with childhood cancer, because there's so many types, they're all considered rare diseases. And rare diseases in the medical community don't get as much funding. It's just a natural way they prioritize funds on numbers. Even the treatments a lot of them are the same treatments that you would be giving to an adult. They're giving to a child. And there's a lot of, I know Boston Children's, when we talked about different ways to fund things there through our efforts, a lot of their researchers are working specifically on figuring out how to manage treatments for children. Because the way that a child's body responds is so different than an adult. And oftentimes even a survivor, a childhood cancer survivor, still has to manage, and this is the same for adults as well, but children have such a longer lifespan to then manage this. The effects of some of these treatments are so taxing on their bodies, and sometimes they're dealing with lifelong health challenges.